Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guest Dave Warner, President and CEO of KPH Healthcare Services, parent company of Kinney Drug. Dave, great to have you with us.
Well, nice to see you, Jeff. Thanks.
Kinney has continued to do well at a time when many other pharmacies, both chain and independent, are struggling. What do you attribute your success to?
Jeff, I think there's a number of factors that have contributed to our success and for us to have weathered, well, I don't want to say that weathered the storm, but have survived these challenging times for retail pharmacy, and they continue to be. But number one probably is employee ownership. We're 100% employee-owned company, so that means everyone working in a Kinney drugstore has the opportunity to become an employee owner of the company. So on a day in, day out basis, our patients, our customers are interacting with the owner of the store. So I think it makes quite a difference. With the scale that we have in our areas, it certainly gives a little advantage over some of the smaller regionals or independents. But number one is definitely the employee ownership. Number two, certainly through COVID and through expanding the number of scripts that needed to be filled, we were early adopters into having a central fill model. So that helped offload some of the volume that our stores had to fill, and it has really made life a little bit easier for them, made them more accessible to our patients, certainly made them much more readily available to administer vaccines, COVID, flu, whatever vaccine was available at the time. So those are some of the factors that have helped. Plus, we have a kind of an isolated rural niche that we are in that many of the larger competitors don't come into.
And your market is upstate New York and Vermont, yes?
Central New York, upstate primarily, and then across the state of Vermont.
And as you alluded to, we've seen Rite Aid, who did have a presence there, go out of business recently. What has that change meant for your stores and the increase in volume you're seeing?
Sure, there's been some increase in volume, number one. Some of the smaller communities, especially in Vermont, we're one of two, now we're one of one with Rite Aid departing, so we're picking up the rest of that volume. We actually did take over several of the Rite Aid stores in the state of Vermont in communities where we didn't have pharmacies, so that was another opportunity for us, expanded our footprint in the state of Vermont, so we really have pharmacies from the Canadian border right down to the Massachusetts border, so we cover that state very, very well. So it did provide an opportunity, as well as some of the other large chains, as they have exited market or downsized, has led to opportunities for us.
Your pharmacists are critical healthcare providers in those rural communities and all the communities you serve, but particularly in the rural ones. How do you see their role expanding and evolving as time goes on?
I think this is a great point for pharmacy and pharmacists. It's a kind of an opportunity that hasn't been there in many communities. Our pharmacy is the only healthcare provider that's there. There is no primary care, there's no hospital, no urgent care. So we're the first stop. We're the place that people go to for their healthcare in many of these rural communities where there is no primary care.
And what can your pharmacists do for patients beyond filling prescriptions and advising them on how to use them?
Sure. Well, right now, with scope of practice, or what pharmacists can do, vaccines is the most common thing that we're making sure that all the patients get all the recommended vaccines that they're supposed to have, as well as kind of triaging to assess the symptoms that patients may have, and at least give them recommendations. Should they go see a doctor? Should they try to find some type of telehealth? Making recommendations like that. Biggest thing and opportunity that's coming along that we see for pharmacy, and probably again, as I started with, is the most exciting thing, is that pharmacists may have the opportunity to expand their scope of practice, meaning they can test and treat, they can do more, provide some of those primary care functions that don't exist, especially in the rural markets where there is limited or no primary care. So we're on the edge or the cusp of some exciting times for both pharmacists and pharmacies. Let pharmacists practice at the top of the license, as it said.
Let me ask you this, as we said, many of your stores are in rural areas. How will the government's rural health transformation program affect your business?
Well, as you know, Jeff, it's early in the rollout of this. The funds are just um, being made or starting to become made available. We're hoping that state by state and even at the federal level that pharmacists are allowed to do more than what they can do today. Like I said, expanding that scope of practice so that pharmacists can do things like blood pressure checks and diagnose and treat cholesterol, diabetes, a lot of these everyday disease states that go untreated, unrecognized, that pharmacists can be there to perform those functions, provide the service that is lacking from primary care, and finally be reimbursed for those services, which today we haven't been, and will be a critical part in being where pharmacies can expand the scope of practice, expand what they're doing. Um, so we're looking forward to these funds becoming available and being part of that rural health transformation. And what does health look like in rural markets across the country? And Kinney's plans to be a key role in that in the states that we serve, since they're very rural markets.
And are the officials in New York State and Vermont eager to implement this program?
It's in its infancy, getting the rollout and what's it going to look like and how this is all going to work. That will happen this year. But we're trying to be first and foremost in the process. We are seeing in both states that there is legislation being proposed to expand the scope of practice for pharmacists in both states, which would be an absolute positive. So, again, the rural health dollars that have been proposed for each state could play a valuable part in seeing what pharmacists can do and what Kinney's can do in the markets that we serve.
Dave, let me shift gears here and ask you to talk a little bit about what KPH does beyond Kinney. I mean, everyone knows the drugstores, but you do a lot of other things. Maybe you could talk about those activities.
As you said, Jeff, Kinney Drugs is the known name. We've been around for over 120 years. Certainly well entrenched in the markets that we are in, but over time, we all know that retail pharmacy has become more and more challenging. Reimbursement pressures have made it more difficult for every pharmacy. So we've, over time, things that we used to do in the stores, example being long-term care, servicing nursing homes. So we actually took all of that business out, created another division that actually services nursing home, and they've long since gone beyond the footprint of Kinney Drugs in central and northern New York and Vermont, and expanded to many states as far west as Missouri, Wisconsin. So we have closed door pharmacies that do nothing but service institutional or long-term care nursing homes. That's just one of the divisions. We also have our own PBM. We have mail order specialty pharmacy. So that was something that all the stores did. We centralized it so that each store didn't have to stock as many of the expensive specialty drugs, and more of an inventory control and let it be more centralized, and it's created a whole business out of specialty pharmacy. And probably the biggest initiative more recently is home infusion and home care businesses that we've acquired and or have grown out to try and support people's desire to be home, not be go to nursing homes and stay at home as long as they possibly can. And we're trying to play a major role in how do we support their desire to be at home.
And you talked about the diverse range of components that KPH has. How do you try to leverage those and build synergies among them to benefit the patient and I guess the payer as well?
It is exactly that, aggregating or synergies between the organizations or the different divisions by even like purchasing. How does one help one another? We aggregate all of those. KPH is actually administrative arm, so we provide administrative support to all of our divisions, whether it be HR, whether it be accounting, so that each one can more focus on the day-to-day operations, more focus on their care of the patients and their clients that they serve. So it's more more support than anything else for all the different divisions. They do cross over. I mean, a lot of times we take patients that are in and out of rehab or nursing homes or hospitals, and each of them kind of hand each other off. One of the bigger focuses recently has been as people getting discharged from a rehab center or getting discharged from a hospital, they need different pieces, and we have all those divisions that support them, but actually aggregate them together. So one person who is a liaison is somebody who makes sure that they're getting their prescriptions from Kinney's or getting their infused drug from Aristocare, another one of our divisions, or Kinney Home Care, making sure that they get the wheelchair or the hospital bed delivered to the home. So it's coordinating all those services so that the person can transition from whatever point of care that they're in back to their home or back to whatever setting it is, and more helping the caregivers make sure that everything that their loved one needs is there for them.
Dave, a final question for you. In April, you will become chairman of the National Association of Chain Drugstores. What are you going to prioritize as you take on that added role?
Fair reimbursement is top of mind for everybody in the retail pharmacy and will continue to be, but changes in opportunity and scope of practice for pharmacies, expanding services, this rural health opportunity, that's probably going to be the biggest focus over the next 12 to 24 months, not only for myself, NACDS, but really for the whole industry. This is a kind of a turning point, at least I feel is a turning point, and an opportunity that we need to seize the moment and try to take advantage of what's there for pharmacists and pharmacy.
Mhm. Well, let's hope this is finally the year that that gets done under your
Yes.
leadership.
Well, we can only hope, right there.
Well, thanks for your time. Thanks for sharing your insights, and always good to see you.
All right. Thank you, Jeff.